In honour of International Women's Day, Debbie's Dream Foundation is spotlighting women whose leadership is shaping the stomach cancer ecosystem. This year's International Women's Day theme, Give to Gain, speaks to something we see every day, that meaningful progress happens when professional women lead by giving their expertise, insight, and support to others. I'm Amanda Pullinger, CEO of Debbie's Dream Foundation, Curing Stomach Cancer. And throughout March, we'll be sharing conversations with women across research, medicine, advocacy, and innovation, exploring leadership, impact, and how giving creates lasting change. As we continue our International Women's Day series at Debbie's Dream Foundation, I'd like to introduce you to Jin Young Park, who is lead Gastric Cancer Prevention Team at the International Agency for Research on Cancer in Lyon in France. Really lovely to meet you, Jin.
Thank you very much for having me.
So my first question is really about your motivation for getting involved in the cancer field. So my question is, what moment or influence or person most shaped your decision to work in the cancer field?
I was born in Korea and spent about half of my life in Korea. And then I grew up in a very supportive family who valued basically education, as in many Korean households back then. But looking back, my parents were, of course, like my biggest influences, and especially my mother, at least for the first half of my life, because she was literally a superwoman, and raising my brother and me, packing for lunch, dinner boxes every day, caring for my grandmother, managing all the household's responsibilities, and supporting my father, who was a very busy journalist then. But at the same time, she maintained a successful full-time career for herself. And then she still was very enthusiastic about her job as a teacher. I'm not sure how she managed to do all of that, right? It's just impossible for me. But when I asked her, she said like every mother had to do that at the same time, and it was not really nothing very special for her. But what was really special for me was her constant commitment to learning and challenging herself. And then so my interest in like cancer, it's not really academically like influenced by my mom, let's say. However, but the way that I'm like enthusiastic about learning and basically challenging myself actually would come from like mostly from my parents, especially my mom as a role model. But then I also cannot leave my, for example, if you are really asking about people like who influenced me to shape my career and then who I am, I cannot leave my husband unmentioned. Like so, for the latter half of my life, has been one of the really biggest influences and also instrumental in shaping actually the person who I am today. Because I remember once wearing this old T-shirt said, "Behind every great man, there's a great woman." And he immediately commented on the point, saying that the opposite is also true. Come on. So he is the person who made me feel that like we don't even need a day of special celebration of women. It's like because every day is and then should be special. And so he always like lived by that value. And that has been incredibly important to me. And so in terms of like, in terms of career, and then not really academically like a research itself, but these are the people who influenced me being independent researcher and then also being enthusiastic and then also committing to learning and challenging myself. So yeah, so that's basically my earlier influences.
It's so interesting because on your latter point about your husband, I'll always remember in Sheryl Sandberg's book, Lean In, one of the points that she makes is that for professional women, the most important decision is whether you'll have a life partner and who that life partner is. And I think it is so true. I see so many professional women in senior roles across different industries and sectors. And very often, particularly if they have a family, there is a partner, behind them who is doing, the supportive work, and it definitely does make a difference. So thank you for sharing those kind of early influences. Um, so I'd love to know from where you sit today, and perhaps you'll talk a little bit about what you do today. Um, what, what do you think are the challenges? And then we'll get into the opportunities, but let's start with the challenges in the GI stomach cancer field today. So talk a little bit about what you do and then what the specific challenges are in the stomach cancer field.
So, I'm leading Gastric Cancer Prevention Team at the agency, and IARC is specialized cancer research agency of the WHO. So we are providing necessary evidence for the WHO to decide and implement as a policy. So we are in a very collaborative relationship. So our team is responsible for generating scientific evidence for different prevention measures for gastric cancer. So the team's work involves from the descriptive epidemiology. We are also very interested in describing current burden of gastric cancer, but also future burden of gastric cancer. We are also very interested in understanding what will be the impact of various strategies, preventive strategies will be currently and then also future. So that will be the descriptive part of the work. We are also heavily engaged in etiological work. So we are trying to understand still what causes gastric cancer. Of course, like H. pylori being the major cause, but still we try to understand the carcinogenesis itself, and which are the factors that we could modify and then could be integrated in the prevention. We are also co-leading certain clinical trials to see whether this primary and secondary prevention will reduce gastric cancer incidence or mortality. And then these are two large clinical trials, which is ongoing, one in Korea and then another one in Latvia. It's called HELPA and G-STAR. These are the clinical trials that we still try to obtain the more conclusive evidence about different preventive measures. Then we also, the Gastric Cancer Prevention Team at the agency is also leading the European-wide initiatives on gastric cancer prevention. So not only that we are being involved in different European-wide projects such as EuroHelicon and TOGAS, where the Europe would like to really see as part of the Beating Cancer Plan, whether implementation of this H. pylori screen and treat strategies at the population level as a program will reduce the gastric cancer across the European countries. And we are now, we have just launched basically the Europe-wide project called European Commission Initiative on Gastric Cancer. It's part of a major European Commission Initiative on Cancer, so which is ongoing for colorectal, cervical, breast, and then there are also 3 new cancer sites, including lung, prostate, and gastric. So I'm leading this gastric cancer part. We are working with this independent the working group who will make the decisions on the European-wide guidelines development for gastric cancer prevention, and then quality assurance scheme, which will be an actually vehicle for actual implementation of the prevention strategies across Europe. So these are the levels of the dimensions of the team's work and the different projects being involved. And therefore, we are trying really to generate needed evidence, for as part of the scientific investigation, and then to be used in terms of public health policy and to reduce ultimately gastric cancer burden globally. I think your question was like what the challenges were and then opportunities. So I started my postdoctoral training in 2010, and I started working on gastric cancer prevention around 2011. And at the time, it was like 15 years ago uh, that I felt often frustrated by the fact that so I'm being seen as a junior PhD, not an MD, and then female young scientist. So, which was actually really challenging at the time uh, to convince people about the research ideas, the importance of the project, that to be implemented or discussed. So these are now much better, I guess, but the barrier at the time when I first started was actually as a female epidemiologist, it was quite high. So those were the challenges personal career perspective. But also gastric cancer in general, if you see that one as a topic for research, we all know that relative to other cancer sites, gastric cancer has been somewhat under funded in a sense. So we have had a little, like relatively little opportunities for uh, large funding possibilities and different large global collaborations. So because I was very conscious about it at the beginning of my career. And then my goal is actually really to lower the barrier also for the younger generations, also for the young early career scientists to enter more easily and to expand the work, especially at least for me, the prevention part is equally important as treatment, or equally important, or even more important, even so, because we can also save many lives before the disease can develop. So these are the challenges, but at the same time, I consider them as opportunities as well, because now that there are like major gastric cancer projects currently ongoing, I think I see a lot of opportunities because it's so far, uh, let's say, has not been so actively like researched, then we have more opportunities to expand our research and to investigate further. And so there are a lot of, I guess, upcoming opportunities too.
So one of the areas that's been fascinating for me in my 12th week as CEO of Debbie's Dream Foundation, if I look back 13 weeks ago, I had never heard of H. pylori,
Hmm.
which seems incredible to me, given, as you said, the high percentage of stomach cancer cases that are caused by that H. pylori infection.
Hmm.
So let's talk a little bit about H. pylori screening. And I'm wondering, and it's interesting that you were born in Korea, and I've spoken to colleagues, in Korea in this area, and I've just come back from a conference in Japan, in Okinawa, where there was a large focus on the value of H. pylori screening, and in both Japan and Korea, and the data is clear that if you have regular screenings for at-risk populations, it both reduces the number of those that get cancer, but also enables early screening. So it means that the stages at which someone contracts cancer are much earlier than they used to be. Of course, there are still late stage. So I'm just wondering, from the context of what's going on in Europe, what is happening around communicating that need? I mean, it does seem like there is a role for a Debbie's Dream Foundation, for example, to really talk about what the general public needs to know about
Right.
digestive health around the opportunities to have screening in place. But from an agency perspective, what are the challenges in terms of getting governments within Europe interested in this topic?
For Europe, we are very lucky because Europe's Beating Cancer Plan that included already gastric cancer to be considered for prevention, either recommended for through the H. pylori screen and treat in high risk areas. So what we are now trying to do is we try to define what it means by high risk areas or high risk population, and then the screen and test, screen and treat strategies, how that as a program for the population program, how it can be implemented, etc. Those are the ones that we are now trying to uh, develop the guidelines about. So it's strictly evidence-based, and Europe is at the forefront of now implementing such strategy as a population-based program. And so it is almost like the very first, in addition to other parts of the world that they are now launching as a nationwide program. So it is interesting that such initiative was started already in Europe, and so we are actually advancing the gastric cancer prevention area with the help of such a large major initiatives in Europe. So it's a challenging work because it's the very first attempt to develop evidence-based guidelines on the primary prevention strategy across the whole Europe. So it is challenging, but it brings a lot of opportunities because this can be adapted in many different parts of the world because Europe is not homogeneous in terms of the rigors and the population risk and the disease burden. So it's a completely heterogeneous. And so if we are making the guideline for a certain the aspects like for their rigorous settings, certain settings that should be applicable also for other parts of the world where the with the similar settings or where the populations at risk, population characteristics are similar, etc. So there are a lot of challenges, but at the same time opportunities coming from these European initiatives. And then being Korean, I feel very lucky that that I am working on gastric cancer prevention because even if I work for the international organization, but being Korean like you, I'm also proud that I'm contributing to the prevention of the disease that affects a lot of people in my home country. The H. pylori is now, even in Korea, like, people are more and more aware of this carcinogenic role of the infection. However, we are now still waiting for this conclusive evidence from the trial that I briefly mentioned for Korean population, but which will still be applicable to the rest of the world. And this trial evidence is important because it will consolidate the current evidence about whether when we know that H. pylori causes gastric cancer, the larger part of gastric cancer, we also want to know whether the eradication of it will reduce gastric cancer risk. And then that's being studied in many parts of, in many studies. However, this HELPA study, and then there are like some other studies still ongoing because it needs long follow-up. And then that will help like really clarify the role of that treatment part, where the screen and treat will reduce gastric cancer risk at the population level. But Europe is a bit ahead of this because they, based on the evidence they are discussing now, we are discussing actually really how to do it.
So I think there are two things that I've observed. Now, certainly in the US, one of the roles of Debbie's Dream Foundation is to go on Capitol Hill and to advocate for more funding. In fact, every year we have to go to Capitol Hill to make sure that stomach cancer research is in the Department of Defense bill. And again, a bit of a surprise to me. Why on earth Department of Defense? Well, there is a strong correlation between those that serve in the military, or actively serving, or veterans, and rates of stomach cancer for various environmental issues, obviously change in diet, and the infections that very often individuals will come back to the US with. And so, one of the things this year that we have been advocating for is specific language around a feasibility study for veterans, for US veterans, including an annual screening protocol for H. pylori. And it's interesting because and we will see, and we're very hopeful that this language will get passed, having been on the Hill. But it's interesting, and I'm just curious whether in any of the work that you've done, whether there's been any focus on the military, because I have brought this up in the UK, because presumably if there are greater cases in the US military, the UK military, for example, is going to the same places, the same parts of the world, and are in similar conditions, in circumstances. And so what's interesting is I think there is a top-down approach, and obviously a lot of the evidence you're providing is to ensure that governments, within Europe, and those agencies that are responsible for prevention methods really see the cost effectiveness of doing the screening and the testing in the first place. But I also think there's a role for a bottom up, and that's a lot of what Debbie's Dream Foundation is doing is, if you like, the marketing, the PR side of it, which is to encourage individuals to ask for this testing. So I understand that you're involved with the guidelines, or etc. But is there anything that you're doing as an agency? So first of all, question around the military and whether that is a population that you think is an interesting one to look at. But then secondly, is there anything the agency is doing around educating the general public around asking for this screening? Because I think it would be really useful for the US to know what has worked, or what is being planned in Europe.
Yeah, so that's actually a really interesting question about military population, because we are aware of the increased risk, especially in men, about gastric cancer, and then also H. pylori being an infectious agent. It is also clustering in certain populations, and so military will be one of the examples about that high risk group. However, we once tried to access the population from the military service personnel in Korea to be part of the trial. But with many challenges around recruiting, it was actually not easy. And then there are also other populations in addition to the military and then others. But for example, indigenous population in New Zealand, like Maori, has a lot higher risk compared to European New Zealanders, and also the Canadian Arctic people, etc. So there are even if you have overall relatively modest or low risk of gastric cancer, but there are always a high risk populations. Also in Europe, the immigrants coming from high risk areas, they maintain there's a nice systematic review showing that they tend to maintain their risk even if your environment is you moved basically to low risk areas, etc. So there are different populations that we always need to be aware, and then also for them, we need to promote basically the importance of prevention, etc. So to link it to the next part of your question is that in the European initiatives, it's basically we are currently reviewing all the evidence and to be able to develop guidelines that it's feasible to be implemented quality assurance manner across European countries. So the evidence is therefore a bit limited because we still encourage generating more data through pilot study, through feasibility studies, etc. But what European initiatives are useful about is, for example, Eurohelicon or TOGAS project. There are pilot countries where they have piloted such implementation of such programs and younger population, and we learn a lot that, as you correctly pointed out, Amanda, not many people are aware of the H. pylori, the infection, the role of infection, etc. So there are a lot still to be done. And then we are lucky in Europe in the sense that there's a strong political will so that the Beating Cancer Plan already included gastric cancer prevention, which is already such a great start. But then to be able to really implement the program in a very feasible and then quality assured manner, it's really important that we have the data generated through those pilot programs or demonstration programs. So those demonstration programs are also instrumental in terms of raising awareness. So we are now starting work. We are a bit behind in terms of the implementation of the prevention. We are learning also from other success from other cancer types, but we are now moving on to it. So of course, we have very little evidence or data to begin with, but we are now moving towards implementation of such strategies for effectiveness and then to make the program more tailored to certain populations.
Well, I can tell you that as I travel around the world, I'm telling everybody about H. pylori. So I'm doing my own little publicity plan because it's just so obvious, right? It's just a no-brainer to ask, and certainly for those that I know in the US, I'm saying to them, ask your doctor for a test, and let's see what happens. Well, this has been fantastic. And as we close out the interview, I have a final question for you. And that is, and you alluded to it a little bit about some of the challenges in your early career in this area and being to ensure that you're getting the respect that you deserve in your early career. For women who are considering leadership roles in the healthcare sector or research area, what's one thing or a couple of things that maybe you wish you'd known when you were a teenager, right? What would you tell your teenage self around the career that you've had and what you wish you'd known back then that would have made things perhaps a little bit easier in your career?
That's actually really difficult question because I think it wasn't really lack of respect, I must like what I was frustrated about. It was rather the barrier itself. It's really not about getting recognition. It was about just being accepted as a peer at all, so to be part of the team for gastric cancer. What's really difficult was because I had an epidemiology as a background, not a medical background. So that was challenging in a sense that at the time of early career, somehow it felt to me the necessary to be qualified even to discuss anything about gastric cancer prevention. However, now I think after really long collaboration, what's really important is the mutual respect, and then we really need a multidisciplinary team. So because, for example, not all clinicians may have the same understanding of epidemiology. Likewise, as an epidemiologist, we lack sometimes, we do not have the full picture of the whole clinical aspects of it. However, also even for the European initiatives, what we really need, for example, the voice from the patients of advocates or the caretakers, etc. So it is like not even the decision modeling or the social scientists. We just really need to be the team. So what I would like to say to me, like 20 years ago or 15 years ago, when I was just starting my career, is that don't be frustrated by the fact that you don't know about everything, because that comes with a collaboration, and you are not expected to know everything, and don't be ashamed of it because it will come and then you will learn. And but you also really need, for example, clinicians' input, patients' input, and everything. And then they also need our input to make this gastric cancer as a global problem to be tackled urgently in a coordinated manner. So we are a team all together. So I really look forward to continuing working with everyone in the world, basically, to um, to really address this gastric cancer as a global problem, and then to reduce the burden of gastric cancer.
It's fascinating because many of the conversations I've had, and I've had them with oncologists and surgeons and you know those who are in the patient advocacy space, it's fascinating that they've all said the biggest opportunities we have going forward in this space are by working together and collaborating. The learning from other cancer types, the learning from people who are in different roles is really where the opportunity is. And obviously the, you know, the drug industry as well, in terms of bringing everyone together to tackle what is still a big challenge. So it's really fascinating, and I think a wonderful place to end, that collaboration really matters as we move forward.